Good evening and thank you for joining us tonight for our 18 News digital exclusive State of the Virus. Now, as cases of COVID-19 continue to rise across the country, 18 News is asking our viewers what questions they have for local doctors regarding the virus. And today we're joined by Dr. Michael Scalzone, the Chief Quality Officer at Guthrie. Thank you for joining us, Doctor.
You're welcome, George. Glad to be here.
So, Doctor, we've seen more than 100 cases being reported in our viewing area every day, and there are fears that the cases could continue to rise through the holiday season. So what is the state of the virus here in the Southern Tier, and how are you guys at Guthrie and other hospitals handling this?
So I think the way you described it is very accurate. We've had a significant increase in the last few weeks, primarily since November began. And even after Thanksgiving, we've seen another increase. So in the summer, we felt very pleased that there were low rates of hospitalization and low rates of infection. And then we began to see more positive cases in the community. Not surprisingly, within a week or two after that, we began to see more hospitalizations and more people become seriously ill.
All right, so Doctor, we are coming out of that first major holiday of the season with Thanksgiving. Have we seen an effect on those gatherings so far? And what are those concerns going to be once Hanukkah and the Christmas holidays roll around later this month?
That was indeed the worry, and quite honestly, we are seeing that. We've seen the rate of positive cases go up and the rate of hospitalizations go up. And with the contact tracing that's done by our local public health officials, it seems that the majority of the transmission is happening in small gatherings rather than previously in this pandemic where large gatherings or lack of mask use or social distancing was responsible. So it really has changed to the smaller gatherings in homes. And we think Thanksgiving time, where there were more meals and more people coming together, unfortunately has led to an increased number of cases.
Yeah, and so there's been a lot of discussion, Doctor, about these full or partial lockdowns, some that we had in the spring and some that could come a little bit later on. And we have a question from our first viewer here. Dan from Hornell asks, what effect did the first lockdown have on the spread of cases earlier this year?
Well, the data was pretty clear, George, that when the lockdown occurred and people began staying at home more, the case rate definitely dropped. We could see that happening throughout the late spring and early summer. As it eased over the course of the summer, there was a slight increase, but it wasn't dramatic. As the fall began, it really began to change. So I would say that the lockdown was effective. It did help, and we've seen a change since it's been released.
All right, and so with people staying indoors more, a lot of people in our area are living in apartment buildings or these shared buildings. Should people who live in there be concerned about the air that gets circulated, whether it's through the AC or just those general living areas during these winter months?
It's an understandable concern. There's no doubt that air circulation is important, and during the summer months, we think that because people were outside more or perhaps had windows open more frequently, there probably was a lower risk of transmission. On the other hand, there has not been definite proof that transmission of the virus has occurred through air conditioning systems or other heating and ventilation systems. So that is a theoretical concern, but we've never been able to prove that live virus is spread through that method. So I think that people in apartments should use the regular protections that we discuss, wear masks when appropriately, keep your gatherings small, but shouldn't be overly concerned about an additive risk in their housing.
All right. But great information to know. We have another question here. This one's coming from Evelyn in Millerton, and she asks, how often should I get tested for COVID? And of course, I believe that would depend on where you work and what your risk exposure is. But doctor, should people be getting these routine tests for COVID-19, or should we be saving these tests for people who may need them?
Well, George, I think the way that you described that was absolutely right. It makes a difference with where you work and what your exposure is. So there's three large categories of people who should be getting tested. First, clearly, if you have symptoms and you're concerned that you might have coronavirus. So you can try to arrange testing, you can call your primary care physician, and they can help guide you as to where and when you can get that done. The second time would be if you had exposure. So if you feel like you had a high risk exposure or you know you were close to someone who does have coronavirus, that would be another time it would be very important to get tested. And our public health authorities and your primary care physician can also help guide that. The third case when it's important to be tested is tied to where you work. So we know that individuals that work in nursing homes or other healthcare facilities are tested on a regular basis, and your employer will help you understand that. But the general population does not need to have routine testing if they're feeling well and they haven't had any significant exposure. And that is where we would like to conserve tests.
All right, that's more great information to know. And now, as we turn to the vaccine, we've seen a lot of pharmaceutical companies such as Pfizer and Moderna say that their vaccines are more than 90% effective and that they are safe. Earlier today, just an hour or so ago, the governor unveiled a plan for New York on how they're going to distribute the vaccine and who's going to get it first. So, doctor, what is the state of the COVID vaccine right now, and when should the general population expect to get that vaccine?
So we're very excited that the vaccine's available. And as with everyone else, those of us in healthcare have been waiting for this moment. I know folks are concerned about the safety of the vaccine, but as we look at it from a scientific standpoint, while the process has been rapid compared to some others, we don't feel that there's been any corners cut on safety. The people have been carefully monitored. The side effects are minimal, and there have not been serious repercussions from those that were vaccinated. So the process was rapid, but still careful. The effectiveness is, as you described, it was greater than 90%. And that is really, really unusual for a vaccine. So we're really pleased with that. We're really pleased with that. As far as when the public will be able to get the vaccine, it's going to be delayed. The initial number of doses is limited, and we fully expect it's going to be late winter before the general public will be available to be vaccinated.
All right, doctor, of course, speaking of vaccine, one more viewer question here, this one coming from Gwen, and she asks, will people be able to get the flu shot and the COVID vaccination at the same time? Will people be able to get sort of a double dose of these vaccines, or will they have to spread them out, especially if some people are going to have to wait until next flu season in the winter?
So I think there's two important parts about this. We give more than one vaccine on a regular basis, both to adults and to children. So it's very common to get both the flu vaccine and a vaccine for pneumonia, to prevent pneumonia. So we fully expect that it's safe for both the COVID vaccine and the flu vaccine to be given at the same time. Now, having said that, we really encourage people to get their flu vaccine now and not wait until later in the winter when the COVID vaccine will be available. But in short, it is safe to get them both.
All right, doctor, well, we really appreciate you joining us today. And viewers, if you have questions regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. And of course, we'll have more on the fight against COVID-19 on 18 News and mytwintiers.com. Have a good night, and thank you for joining us.